Training is very specific to the health department because we are working with the health department very closely. The training program is, as you've seen in the brochures and in the banners also, is about data for decision making. We are talking about evidence-based decision making here. And what we notice is that unlike years ago, decades ago, when data deficit was the issue, now we have a problem of plenty. In a sense, our collection of data it has improved considerably, but the question is, what do we do with this data that we have collected? So that is the question we are trying to answer here. Our formative research has shown is that there are a lot of data collected at the ground level by ASHAs, by the MLHPs and the other health department workers. But these data are not used in the manner we feel they can be used, because these are very powerful things that we have that could potentially change outcomes of health in our state. So when we did the formative research and we tried to find out how this data is, what is the track of the data, where does it go, what happens with this data, what we have realized is that the data is aggregated and it is discussed at a very high level, at the state level. But we wanted to also understand whether at a district level and the block level, their own data can be used to improve their work, to improve their outcomes, to improve their numbers, their indicators in the blocks, in the districts. So when we asked this question, what we found was that there's a little data anxiety among the people that are using it. There are issues with data quality, for example. There are issues with not being able to analyze and make meaning of data. So this workshop kind of addresses that issue, where we are training the district officials to look at data differently, to be able to analyze that data correctly, and more importantly, to use that in their day-to-day work, in the interventions that they will design. Data should drive that intervention. So that is what we are trying to do with this. I can tell you that the area we're attacking is actually the supply side. The health system is what we are trying to address issues for. But you can understand that when decisions are made based on evidence, the people who will enjoy this will be the people who are using the system. So for example, we are looking at, let's say, maternal mortality issues, right? And we have data that says that maternal mortality ratios are very high. The report will say that it is high, but it is the analysis that is going to unpack to see why these numbers are high. So we're kind of teaching them to look at numbers and to ask these difficult questions, because what that will do is it will help them design interventions at their level, at the district level, to kind of address that issue. So who are the beneficiaries for this if a good intervention is designed, and if the health service delivery is made better because of these data? The people only will benefit. So they will enjoy the benefits of this decision and intervention that they're making using the data that we have. So these are what we call evidence-based decision making, and the overall health of the population will also become better.
Okay. I think this workshop is very important for not only the district officials, but also the top level officials and then officials at the PHCCS level, because I feel after this training we are more aware of how to use the raw data and make it into something meaningful. So at the individual level itself, the level of data collection itself, most of the medical officers, data entry operators would be able to do the analysis at their level itself, instead of waiting for the district or the state to give them feedback. So I think such exercises should be held frequently for all the different levels of officials at the health sector.
Prangnam Ada Raju.
Salam nono riba.
Tarode namin sulinga ma.
Namen sulinga ba?
Angna jani resun ko nat kubo.
Monat ken.
Ada. Era meta ko merong sa.
No. Yade plus F ni nisan tunggu pa. 45 merong sa.
45 tunggu pa merong? Hindi pa ada. 45 merong aro ramram man ko pa merong ra dengdang ma. Nara phangna ramram man ko pa merong khosa phala chimba.
No. Anching salgum ko je ko ba chaya. Anching ni anching baljo kanisa pangchaka. Dau wian iran dake maya gemakchi anching ara. Thik somai kata maninga ma. Thik somai kata manjagen chim ode anemia. Mani de an sibilgriani. Night blindness, and that can wallow nagna man gija pa sabi sirang na ba donga.
Ada ya gemakara 45 merong baksara may baktong para.
Rani kangani donga ano. Anchingni salan tiyo cha aniyo. Beena banga namgani rangko. Jekai iron, folic acid, vitamin B12, iodine, zinc, vitamin A aru D managta amja. Jeni gamanan dakba sabisi unaba donga. Sorkari ansing baljokani kurai makrakata. Tao FSSAI on ani kita merong, ata, kari, dud, aro mungsongpa thorango. Beena namgani rangko daude chimunge paskageno. Jechin naa salgamako Platsiba 10% beena sing baljokani ko mananggen. Yako nagana 45 ko chaimung masibo. Yako ansing altua en plus F ni nisan ko nakemuna masyagen.
Andi ba ada plus 8 tongga ba reson chingara bauni ko mangen.
Nono yano. Uni gamanan sorkario reson scheme rango jekai ICDS, MDM, PDS magsongani de yarango pangchakani. Jechin mungsa centrally sponsored rice scheme ni mananigta fortified rice bisa okodongba magaparang ba chini beena namgani rangni gaman resoni dokano manani rang gata nasmang gemuk nan sokatangiya taloni nasmakna aro anching sakan tini noktang rangna mangmang fortified merong
Katade nangnin kake donga ada.
Yako uwiatengpa Commissionerate of Food Safety Meghalaya.